According to the Ministry of Health, influenza is a disease that has a lot of complications, especially for people with comorbidities, such as hypertension, diabetes, and other comorbid conditions in terms of respiratory ailments. The warning signs for influenza vary from that of the common cold.
The influenza virus itself, it has somewhat of a quick onset. You also have very high fevers, muscle aches, body pains, and then your convalescence period is much longer than your common cold. Your common cold is typified by upper respiratory symptoms such as runny nose, sneezing, and so on, whereas the influenza virus more commonly has lower respiratory tract infections and so on, including muscle pains, body pains. It could present with diarrhea, vomiting, other GI symptoms, and so on.
Pregnancy also places people into a high-risk category in the context of the influenza virus. The Ministry of Health says every year there are cases of influenza in pregnant women, while records show in previous years there were maternal deaths as a result of the flu.
In pregnancy, because of the altered state in terms of your physiology, you have a large uterus, you have less area for breathing and so on. Especially in the last 3 months of pregnancy, you had increased incidence of being hospitalized, getting into an ICU, or even dying. And this is a worldwide phenomenon.
The Health Ministry assures that the influenza vaccine currently being administered at health centers across the country has been approved for pregnant and breastfeeding women.
For women who accept the vaccine, you create antibodies that will pass across through the placenta and actually go to the unborn baby whilst in utero and give some level of protection for that newborn baby. The flu can cause stillbirths, preterm labor, as well as having smaller babies, as well as the maternal complications.
And the vaccine has the same effect when breastfeeding as the antibodies go to the baby while breastfeeding. Babies from as early as 6 months of age can be vaccinated for influenza.
For your young children between 6 months and 5 years, usually they can't really explain some of the symptoms that they're actually feeling. So usually they get sick very, very quickly. And because of their size and their age, it's very difficult for them to recover quickly. Vomiting and diarrhea as well is predominantly seen within this age group. So it's really important for our parents of these younger age groups to get them vaccinated because of the risk to them as a result of very high fever and consequently dehydration.
The most common symptom of influenza in the very young and the elderly is dehydration. The flu season typically runs from October to May or June of the following year. I'm Karen Cozier-Phillip with your TTT News Health Check.